Good morning, everybody. I am Jimmy D. Welcome to another video. Today we're going to be doing an MG tube placement on our little patient. And as always, we're going to be observing GPSP principles, safety practices. With our 11 rights, we're going to be observing our 11 rights, make sure our patient is safe. And if we have any medications to give, of course, we'll also do our med checks. 2 at Pyxis, 1 at bedside. So kind of let me give you the scenario. So doc has dropped some orders. Our little patient needs gastric decompression with intermittent low wall suction. So we come into bedside. Of course, we want to identify our patient, right? Whatever your facility policy says, name, date of birth, right? We want to compare it against the electronic record. Once we're at bedside, as always, as nurses, we want to do a quick assessment of our patient, right? Because we're going to be doing an NG tube in through the nose, right, down the pharynx, into the esophagus, stomach. So what could go wrong, right? So think in terms of, we've got to do this placement in the nose. So any facial abnormalities, right? If they've had broken bones in the face, this young lady could have been an MMA fighter for all I know. So let's assess her face. Let's have a conversation with our client and see if she's had any broken bones, any facial damage. Also think about things like a deviated septum. That would be good to know. It's okay to ask her to open her mouth, take a look inside, right? Make sure there's no obstruction, not any great open wounds, that kind of stuff. And let's assess for dysphagia, right? It's going to kind of defeat the purpose if we're trying to put an NG tube in, she's having difficulty swallowing already, right? So let's assess for that also. So for the purposes of this video, I've got my bed up to a good working height. I'll put my rail down, and now we're at the place where the rubber can meet the road, right? Now we get to all the fun stuff. So we're going to give our little patient a glass of water with a straw. Make things easy for her in just a minute. I'm going to put out a pad, a little pad for her. You can use a towel, a chuck, whatever you want, that's fine. There may be some gagging, coughing, that kind of stuff in just a little bit. So if she spits anything up, we want to catch it and not let it get all over. So we're ready to start the procedure. So the NG tube is double lumen. The blue side, you never want to stop this up, clog it off, anything, put a stopper in there. We need air draw through this. This is what that's for. This side is for the intermittent suction. We'll also use it for checking the gastric content, and I'll show you more about that here in just a minute. But before we begin with that, we're going to measure for size. We're going to measure for size and fit, right? So you want to start at the tip of the nose, measure to the earlobe, from the earlobe down to about the xiphoid process. Good. And we want to mark it, right? That'll give us an approximate range to shoot for. It's a good starting point. So we're going to do some hand hygiene. We're going to put on a pair of gloves. And we're going to lubricate the tip of this NG tube. We're going to make it as comfortable for our little patient as we can. So, from this point, we're going to ask our little patient to tilt her head back. All right? Good job, baby girl. Now it's going to start at your nose. I'm going to work it down through your nose. Here we go. Good job. Good. All right, baby girl, open your mouth. Perfect. I can see the end of the tube. So one caveat before we begin. One, there may be some coughing and gagging. That's perfectly acceptable. If when we're inserting this and we feel an obstruction, right, we're going to want to stop and assess our situation, pull the NG tube out, and let's reset and maybe try something different, all right? So, baby girl, I want you to take the water in your hand, tilt your chin to your chest. Perfect. Now you and I are going to work together. When I say swallow, I want you to take a sip of water and swallow, and I'm going to advance this down your esophagus into your stomach. You ready? All right. Swallow. Perfect. Swallow. Good job. Swallow. Good. Swallow. Good. Swallow. Good job. Swallow. Perfect. Coming up to the mark. Swallow. Perfect. One more time. Swallow. Great job. Great job. So we're going to hold this in place. We're going to secure it temporarily with a piece of tape. Perfect, just like that. Right, so now while we wait, we're going to call imaging. And we're going to have him come up here and confirm placement of his NG tube. And while we're confirming placement, we're going to check the gastric contents of her stomach. We want to check the pH range. So we're going to take a tubey syringe. All right, so remember just a minute ago I was telling you that this is an adapter for the intermittent wall suction. The tubey syringe won't fit into that, so we'll just take this out. Set it aside for right now, right? Take your tubey syringe. And we are going to pull just a few milliliters, just a very little bit, into the syringe. We're going to take our test strip, put just a couple of drops on. In our vial with the strips, there's a color-coded map on the back. We're going to want to match this to the map. It'll check with the pH, but for the sake of this video, we'll say the pH is between 4 and 5, so we're good to rock and roll. So, imaging has come back. Doc has cleared us to proceed. We have good placement. So from this point, we're going to secure the line and measure it. So we're going to take this temporary piece of tape off, hang on to the NG tube, take this piece of tape off.
Here's what I found.
And we're going to put a new piece of tape on that's been split down the middle, and we're going to wrap it around that line. Perfect. Just like that. And while we're here, we're going to go ahead and mark it. And we are going to measure this line. Be sure to line up your markings correctly. Start where the tape says to start. Pull it down to the end of the line. On an adult, we should be somewhere around 55 centimeters, give or take a little bit. And this one's at 54, so yeah, we should be fine. Remember that number, 54, because when you document, right, we're going to want to put that in our documentation. So if anybody's behind us, night shift, day shift, whatever, and they take a look at that tube, they can easily pull out their tape measure it out, and see the tube that it hasn't moved. So we've got this in place. We're going to take this stuff away. Perfect. Now, with the NG tube, two things have got to happen. One, we're either going to cap an NG tube, or for the sake of this video, we're going to run low wall suction. So I've already got my canister set up, ready to go. I've got my tubing. Just want to connect them. Turn this to intermittent. Double check that we're in the green. And finally, we are going to want to secure this above stomach level to our little patient. Right? Gloves off, hand hygiene, right? And what's the last step, class? If you didn't document, it didn't happen. Document, document, document. All right, guys, it's been Jimmy D. We'll see you in class.